I'm Lucinda. I live in the Los Angeles area. I'm going to have a facelift with Dr. Jason Diamond. I've been doing yoga for over 10 years. I've been teaching for over 5 years.
Exhale, look over your left shoulder.
Yoga has brought a wonderful peace to my life. I practice every day if I can. I'm not used to doing unnatural things like this. I don't even color my hair, so. But as time goes by, the aging process is inevitable, and I've taken good care of myself. I still feel young, but my face is getting older looking, and I think this will just help me look a little younger and fresher. Hi. I have 2 girls. Their names are Grace and Justine. The oldest one, Grace, is 22 almost, and Justine is 18.
My mom is in great shape. She eats healthy, she does yoga, she works out all the time. I would love to look like that when I'm her age.
Let's put the flowers on the dining room table. Or should they go here? Maybe here. Today we're going to celebrate some birthdays. My good friend Lisa's coming over with her 2 daughters, Tiffany and Brittany. They're twins. And her mother's in town visiting.
Happy birthday, everybody.
Happy birthday.
So Mom, how are you feeling about your big day?
A little nervous and stressed, getting ready for everything, you know, because I just don't know how I'm going to be recuperating.
You have a great surgeon.
Oh, yeah.
Great.
Dr. Diamond's the best.
Wonderful.
You met him.
Nice name. I know, he's so cute.
Yeah.
He's not only wonderful, he's adorable. You guys are
very intelligent. I think we all feel like we're in our 30s and we just stay there. I was married to someone for over 20 years who was almost 10 years older than I am. And now I'm out of that marriage and it's time for a change. You know, because I feel young.
You look like my sister.
That's right. We can all go to dinner and we'll look like sisters now.
Hey, Lucinda. How are you? Good to see you. Yeah, you too.
I was working out with a trainer in the gym, and he actually trains Jason Diamond, so he introduced us, and we discussed the opportunity of me having some work done.
Why don't you go ahead and tell me what you're hoping that we can do?
Well, I'm hoping to look rested and a little younger, but not different.
Mm-hmm.
So I'm concerned about, you know, this aging process here, and the eyes.
How old are you?
51.
51. Okay, well, you look great. Yeah, certainly getting your brow up is going to take some years off of you. Close your eyes. Open. So you can open your eyes. Definitely getting your cheek up is going to help you. And getting rid of these neck bands. You're a great candidate for these things. You've got a very beautiful face, great bone structure. I mean, you're made for this kind of surgery.
Well, I'm excited.
If you have any questions, feel free to call me.
Thank you, Dr. Diamond.
All right.
I feel like I have realistic views on this. It's not going to change my life or make my life any better. So I feel like I'll be the same person, but maybe I'll feel more refreshed.
So come on in here.
Today's the day of the surgery. Have a seat. I feel very confident in Dr. Diamond and his procedures, and I trust him completely.
Good morning.
Good morning.
How are you?
I'm good.
Good to see you. Excited?
Yeah. A little excited, a little nervous.
Okay, well, that's normal.
I'm a little concerned mainly about the recovery part.
First I'm going to do is mark you for the brow incisions. You get nice thick hair.
Of course, there's some gray hairs in there.
They look good on you.
Lucinda looks great for her age, and that's because she takes very good care of herself. She just wants a few tweaks here and there to make herself look as young as she feels.
All right, great.
Medicine, okay, sweetie, so just relax, take a few deep breaths.
Today's Lucinda's surgery, and we're going to be performing a brow lift, cheek lift, upper and lower eyelid surgery, and a facelift.
So we're starting with the lower eyelids, and we are identifying the fat pockets that are creating the bulgy appearance to her lower eyelids.
One of the signs of aging is that the lower eyelids begin to look puffy.
So you can see now that we've freed it, you can see this is the fat pocket that's just bulging out. There are 3 of them on each side. So we just finished doing the lower eyelid surgery, and now we're going to go ahead and do the forehead, the brow lift, and the cheek lift. So we made our incisions behind the hairline, which will never be seen, and we're just gently elevating up the tissue. We are getting the brow elevated.
I'm skilled and trained in the most up-to-date techniques and technologies, and I think that that makes a very big difference as well. Sometimes, as you know, you practice for years and years, you get comfortable in the things you're doing, and it's, you know, like they say, it's hard to teach an old dog new tricks. With a younger surgeon, you're up to date on all the newest tricks.
You can see we're looking at a picture here, and I'm just working with some instruments through the small hole and some endoscopic scissors, which are very small instruments that we place through these small incisions and they show up on the camera. Good. It's very subtle, but it's just to get that cheek rotated up and give that nice fullness that she used to have when she was, you know, 10, 15 years ago. The cheek is now secure, now we need to fix the brow, and we don't need to do much. This thing's a little dull now, Chuck. That's a specially designed drill. It just creates a little tiny gap for this little end to secure itself into. Okay, good. And now, we listen for the pop. There it is. And now this thing is nice and secure. You can see that's a nice elevation of the cheek and brow. See, there's still just a little bit of skin to take. Not nearly as much as there would have been if we didn't do her eyebrows. We're going to take skin only on her. No muscle. Everything's gone perfect so far. Getting the earlobe aligned is a very critical part of a facelift as well. Everything's gone exactly according to plan, and I'm very happy and very pleased. And I'm just real excited for her. I think she'll have an amazing result. My youth is of benefit to have, you know, a strong back and strong neck and the stamina to focus for that long without break. I think that's very valuable, and I think it's a real benefit to my patients. Thanks for the help. Thank you, Dr. Friedman.
Thank you, Dr.
Thank you, Chuck. Thank you, Mary. She looks awesome. Hey, look at you. How are you doing?
Good.
Good. You look amazing. How far out are you?
A week.
A week?
Yeah.
You look great.
I'm feeling good. You know, each day gets better and better.
Well, look at the neck is excellent. Nice jawline. Little swollen right there, and that's all going to go up and in, but those bands are gone. I mean, your neck looks beautiful. Cheeks are nice and full. I think this was a total success, though. I think you look great. You definitely don't look done. No one's ever going to say, you know, you look pulled.
I feel like I've done a lot to stay young because I take good care of myself inside. You know, I do my yoga, I eat well, but age happens. You know, you look in the mirror and I see this aging process taking place.
All right, well, it's good to see you. I'm glad you're doing so well. You're welcome.
Hi, you guys. How are you? Ready for our facial? All right. I'm ready for you too. Hi. How are you doing? Good.
Grace and I are here at Studio One Skincare in Montrose. Instead of shopping like we normally love to do, we're having facials.
You look good. How long has it been?
5.5 weeks.
Already?
I had a facelift with Dr. Jason Diamond, and I feel great. Grace, does that feel good?
Yes. How do you feel like your mom's face has come out?
I think it looks good.
I think it looks really good.
It's refreshed.
She does. Looks pretty. You did a wonderful job, a wonderful recovery. You were very patient.
Yeah, just a few nights of crying myself to sleep.
Before my mom's surgery, she looked very young. Now she looks even better, just a little bit younger.
We'll get everything cleaned up, and your skin looks wonderful.
Well,
But it looks good.
A couple times we've gone out and people have referred to my mom as my sister or asked if we were sisters.
This is softening under here.
yeah,
This
that
is
feels
really,
better.
yes,
Yeah.
much better.
We need to take care of the inside as well as the outside, and then we have the extra nip and tuck that can help as well.
Okay. Is that fun?
Yes, that's very
Nice. Thank you.
Thank you, Lisa.
I'll see you soon. And I will see you again in about a month. Okay, it was great. You're doing good. And your face came out beautiful. Beautiful.
If you don't feel young, you're not going to look young, even with a younger face. Of course, the physical body has been affected, but it also is about your mental state, your emotional state of feeling young and feeling good about yourself.